Today, we're continuing our series of walking you through actual government inspection reports of nursing homes here in Missouri and Illinois. We're going through what state inspectors found when they showed up unannounced so that you could have a better idea of what to expect at these facilities. I'm David Terry. I'm a nursing home abuse and neglect attorney based in St. Louis, Missouri. But I handle cases all over Missouri and Illinois, and I've been doing this for 25 years. And in that time, I've read hundreds of these survey reports. The facility we're looking at today is Lakeview Post-Acute. The annual survey was conducted in October of 2024, which is the latest annual survey available as we record this in April of 2026. Now, everything I'm about to tell you comes directly from the official government survey report. These are the inspector's own documented findings, their observations, their own words. Not mine. I'm not offering legal opinions about this facility. I'm just going to tell you what the government found and let you decide what it means. Now, if you want to understand how these surveys work and how to read them yourself, go watch my video, How to Find and Read a Nursing Home Survey. Today, we're going to focus on two specific findings from this report. The first major finding that we're going to discuss involves something that had to be fairly frightening for the residents involved. On the date of this survey, Lakeview Post-Acute had 99 residents. Approximately 12 of 15 of them had tracheostomies. That's a surgical opening in the throat used to maintain an airway. 2 residents were ventilator dependent. In 25 years of deposing nursing home personnel, the testimony I've received is pretty consistent that tracheotomy patients, they're amongst the most medically fragile and highest acuity patients that a nursing home can have, and they require specialized care and trained staff. Here's what surveyors found. Now, keep in mind, residents and employees are assigned a number or letter. They're going to be resident number 12 or CNA 7. So keep that in mind as you hear this. So let's start on page 81 of this report. Quote, during an interview at 11:20 a.m., the resident said she almost died this morning. The LPN did not know what she was doing. She was using the wrong tubing to try and suction the resident's trach. Resident called 911 themselves because staff were not trained on how to deal with tracheostomy residents and ventilators, end quote. The report documents that an agency LPN, which is a nurse from a staffing agency, not a regular employee of the facility, attempted to perform tracheal suctioning on a resident. Now, suctioning clears secretions from the airway, and it's really important. If it's done wrong, a patient simply can't breathe. This LPN was unable to do it correctly and admitted they had never received facility-specific training on tracheostomy care or on the equipment being used. During the same incident, the resident's continuous oxygen saturation monitor had been turned off. A respiratory therapist had to step in and do the suctioning correctly. And when surveyors looked further, they found this, that respiratory therapists at this facility only worked from 7 a.m. to 7 p.m. After that, evenings, nights, weekends, holidays, there were no respiratory therapists on site. Not a one. Even when there was a hallway with 12 to 15 trach patients and 2 ventilator-dependent residents. Now, a registered nurse confirmed to surveyors that staff were not trained on the facility's specific oxygen system, the suction system, or the continuous monitoring equipment that was also reported to malfunction frequently, apparently. So night shift nurses, including agency staff, told surveyors they had received no additional training or even competency checks for this specialized care, even when they were the only nurse responsible for the entire trach and ventilator hall overnight. The administrator was interviewed and acknowledged to surveyors that nurses had not been provided with the training. The medical director, who's the physician responsible for many, if not all, the residents in the facility, told surveyors that she had assumed a respiratory therapist was on duty 24 hours a day, and that she believed only fully trained, competent nurses were assigned to that unit. The facility was cited for violating FTAG 726, which is the federal rule requiring nursing homes to ensure nurses and aides have the appropriate competencies to care for every resident. The second major finding is about staffing. According to this survey, the facility's own internal assessment projected that they needed 1 CNA for every 15 residents during the day and 1 CNA for every 18 residents at night. for a population that included 29 residents with pressure ulcers, 15 with tracheostomies, and 2 on ventilators. Now, what was actually happening at night? Multiple CNAs told surveyors that on the night shift, there were typically only 2 CNAs, and sometimes just 1, responsible for anywhere from 24 to 50 residents. Surveyors documented a specific incident involving a resident that they identified as resident 35. She had clear speech, was cognitively intact, and used a BiPAP machine. That's a device that helps people breathe. And one evening, resident 35 called 911. There was 1 nurse on duty for 40 to 50 residents. That nurse was also covering another hall because a coworker had apparently called in sick. The agency nurse assigned to resident 35's hall was on a break, outside of the building and in her car. So a patient who needed help breathing called 911 because no one came when she sought help. On page 70 of the survey report, the surveyor documented her interview with a paramedic, and I'm going to read that for you. Quote, during an interview at 5:01 p.m., paramedic 1 said the resident called 911 herself. She reported her call light had been on an extended period of time and no staff would respond. She was having difficulty breathing, and the resident sounded like she was in respiratory distress. An ambulance was immediately dispatched to the facility, and in the meantime, EMS attempted to contact the facility to make them aware of what was going on. It took a long time for any staff to answer the phone and to receive report. When EMS arrived at the facility, the resident was lying in her bed with her phone still on the bed. Staff were attempting CPR. The resident was transported to the nearest hospital. This particular facility did not have enough staff and not enough trained staff. EMS had been called to the facility 126 times in the past 90 days. Most of the time, staff were calling because they didn't know how to operate the equipment at the facility, or residents called because there was not enough staff to meet their basic care needs, end quote. The survey also documented another resident who called 911 because their oxygen tubing had come loose and staff hadn't responded to the call light. A call light was documented going unanswered for over an hour. So in this circumstance, the facility was cited for violating FTAG 725, which is the federal rule requiring nursing homes to have sufficient nursing staff with the appropriate competencies to assure resident safety. Now, beyond those 2 major findings, surveyors cited the facility for a number of other additional violations. Because of timing, I'm just going to reference them briefly. A violation of FTAG 580, where the facility failed to timely notify a resident's family of significant change in their condition. Violation of FTAG 658, where required neurological checks after residents' fall were not completed or documented. Violation of FTAG 686, where a physician-ordered wound care treatment for a pressure ulcer was not started for 9 days. A violation of FTAG 695, where the facility failed to obtain complete orders for tracheostomy and ventilator care and failed to ensure staff were trained on the specific equipment being used. A violation of FTAG 698, where a dialysis patient did not have a physician's order for dialysis and the access site was not properly monitored. Violation of FTAG 755. Controlled substances were not being counted shift to shift as required. Violation of FTAG 761. Medication carts were left unlocked and insulin and other injectable medications were not being stored or handled properly. A violation of FTAG 838, where the facility failed to conduct a thorough assessment of its own staffing needs, respiratory therapy coverage, and the competencies required for its resident population. A violation of FTAG 880, where infection control failures, including staff not wearing gowns during high contact care and a catheter bag, left on the floor. So this is the government's own report. It's in black and white. If you have a loved one at Lakeview Post-Acute or you're considering placing a loved one there, I would encourage you to read this survey for yourself. It's a public document, and you can find it at Medicare.gov/nursing home compare, and then just search the facility by name. Once you get there, look under the inspections tab, and you'll see a link to all the different surveys. I've provided a link for you in the description below to help you out. Now look, every report in this series comes from public government records. This is information that exists to protect families, but it's only valuable if families know that it's there and how to use it. So if you want to learn how to pull these reports for yourself for any nursing home in Missouri or Illinois, go watch my video, How to Find and Read a Nursing Home Survey. I'll show you exactly where to find them and what to look for. Finally, if you're in Missouri or Illinois and you want to talk with me about a situation in a nursing home, you can reach our office at 314-878-9797. So we're going to keep doing these facility-specific videos, but if there's one that we haven't done yet and you'd like for us to do a video on that, just write that in the comments and we'll try to get to that as soon as we can. Either way, there's going to be more of these facility-specific videos, so keep an eye out for them, and I'll see you over there.